everyone. Thank you so much for joining the NeedyMeds special topic webinar, RX Outreach, Making Medications Affordable. My name is Carla. I'm the Director of User Engagement at NeedyMeds. And before we get started, I'm just going to offer a few tips so you can make the most out of today's presentation. If you do have questions throughout the presentation, you can ask them at any time by typing them into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the time to answer your specific question, we'll follow up with you via email. But of course, we will provide the contact information for both NeedyMeds and RX Outreach at the end of the presentation. Also, the heads up that this webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find copies of our PowerPoint presentations as well, again, as other materials we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's get started with what is NeedyMeds. So for those of you that are not familiar with us, what you're looking at on the screen is all of our fancy wording about our mission statement and a statement about how we achieve that mission. But the way I explain NeedyMeds is simply that NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. We are open weekdays, 9 a.m. to 5 p.m. Eastern Time because we're in Massachusetts, and we do also have Spanish-speaking counselors. So I always like to put up a screenshot of the NeedyMeds website because our site really is the face of our organization, and it gives me an opportunity to point out a few things. First of all, if you are looking for healthcare savings resources, you can find those under the Patient Savings tab. And as a matter of fact, just this morning, we updated that Patient Savings tab to now read Healthcare Savings. So keep that in mind. We are working on improving usability for those of you that regularly visit the NeedyMeds site. So stay tuned for that website being a little bit more user intuitive, we hope, and be vocal about your experience. Anyway, I did mention also that this webinar is being recorded and it will be available on our YouTube channel, and you can find a link to that on the top right of our homepage. Oops. There it is, on the top right of our homepage with the rest of those social media icons. It's the third one from the left. And you just saw, I jumped ahead of myself, a red box around that calendar of events, which is on the bottom right hand of our homepage. And that's where you can learn about other upcoming webinars and register for them. So please regularly check that out because we do our best to populate that calendar events with webinar topics we think you'd be interested in. So let's get started with the reason you're all here, which is to learn about RX Outreach and the resources they offer. So as you saw a few slides ago in our mission statement, that a big part of our mission is educating people. And we define that by educating people about NeedyMeds, of course, and the resources we offer, but also by educating our users about other ways to save on their healthcare expenses, which is why we are so pleased to have our guest, Bill Vatterott from RX Outreach, here with us today. So first, let me tell you just a little bit about RX Outreach. What you're looking at is a screenshot of their homepage. It's a great website. It's very intuitive, easy to negotiate, as you can see from that screenshot that I've got up there. But RX Outreach is the nation's largest nonprofit, fully licensed mail order pharmacy. It offers more than 1,000 medication strengths at affordable prices. Mission to provide affordable medication to the underserved, RX Outreach partners with hundreds of clinics and organizations across our country to provide a crucial health safety net for those who battle both illness and poverty. Since 2010, RX Outreach has saved people in need more than $662 million, I'm just going to say that number again. Since 2010, RX Outreach has saved people in need more than $662 million on their prescription medications compared to retail costs. So that's a big deal. So now let me tell you a little bit about our guest, my friend and colleague Bill Vatterott, who's joining us today. Bill is the marketing manager of RX Outreach, but as I say, that title doesn't quite cover the extent of what he does, nor his passion for helping people. Bill's worked in nonprofit organizations for over 25 years, including the last 4.5 years at RX Outreach. Bill graduated from Catholic University in Washington, D.C., and later earned a master's degrees in theology and divinity from Kendrick School of Theology. He is, in fact, currently a doctoral candidate in educational leadership at St. Louis University. And I think both his professional and academic experience speak to his dedication to helping people and making a difference in their lives. We're so proud and pleased to have his partnership and the partnership from RX Outreach, and are grateful that he's taken the time to share his expertise with the NeedyMeds audience and show you what RX Outreach is all about. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Bill. And as he grabs that screen and puts up his PowerPoint slide deck, I'm going to remind you that if you do have questions, you can go ahead and type them into that question section of your GoToWebinar control panel. And Bill, and to the audience, please be vocal about this too. Although I do see your screen, I think you need to click on that display settings once again and put it into the slideshow mode. And to our audience, are you seeing that screen clearly? Let me know, because to me, although it's coming through, I can see my slide deck in the background. So bear with me just one sec. Let me get my screen out of the way. And let me just get some feedback from the audience to make sure they can see you clearly. Fantastic. Everybody can see it clearly. And without further ado, I'm going to go ahead and pass the mic to Bill so he can take over the presentation and talk to you all about what RX Outreach is and how it can help you. Thanks so much, everybody. Enjoy the presentation. There you go, Bill.
Thanks a lot, Carla. Good afternoon, everyone. Thank you very much for joining us this afternoon. I think when I talk to a lot of people about their excitement for the holidays, I think they're even more excited to turn the calendar and have a new year. 2020 has certainly been challenging for all of us, particularly I imagine for many of you attending here who are providers that provide health care or that are caretakers for a parent, a loved one, and you're here because you want to get information about how to save money on medication, how to get access. And so our hearts and prayers go out to all of you, and a big thanks as well. We know just from being in the business for 10 years how important family, friends, advocates, doctors, clinics are for the health and care of our patients. So RX Outreach, as Carla mentioned, is the country's largest and only nonprofit mail order pharmacy. So we serve people in all 50 states. We serve people that really don't have access, whether it's because of insurance, lack of a job, or just a lack of knowledge, people that don't have access to affordable medication. So the presentation I'm going to give today is kind of a high-level overview about RX Outreach, and I hope that you ask as many questions as you like, because we want you to go away with an understanding of what I believe is one of the best resources in the country for affordable medications delivered conveniently to someone's home. Before I kind of get into the nitty-gritty, I want to emphasize that our company is a nonprofit, that we were started 10 years ago from Express Scripts. And so we have a history of having kind of a corporate efficiency, but also a charitable heart. This is our president, Daryl Munden. And like many of us here, um, the reason that he came to the company and the reason he still is here, um, are important. They would guide us every day. For Daryl, um, as you can read here, at 15 years old, he lost his grandmother prematurely to a heart attack. Um, that was that he believes was preventable if she could afford medication. That's one of the things that just guides him day in and day out here, and it does really permeate our entire company, from a person in the call center to our president. We are truly mission motivated, and so we're really aligned with many of the providers that I imagine are here today. So as I mentioned, RX Outreach is the a mail order pharmacy. We're based in St. Louis, Missouri, um, and we have everything in one building, 31,000 feet. Our call center is here. We get about 8,000 phone calls a week, process over 7,000 prescriptions each week, and we're fully licensed. We're licensed by the National Association of the Board of Pharmacy. Um, and we report each day to 34 states, and all the states weekly. We are mission to work with safety net providers, and but I'll explain a little bit later, but I think our mission has really kind of expanded, really to anybody now who um, needs affordable medication, needs access to affordable medication. And part of that is just due to changes in healthcare and the Affordable Care Act and such. So we do serve all 50 states, and the Puerto Rico and the U.S. territories, Virgin Islands. We primarily have chronic medications. So we have over 1,000 medications available, and ship over 300,000 scripts annually. Um, and NeedyMeds is probably our key partner. You can see we've received over 10,000 referrals from NeedyMeds this year. And in fact, the webinars that NeedyMeds hosts has really led to a number of significant changes here at RX Outreach. Um, just to give you an example, last year, a few members of the Hepatitis B Foundation attended the webinar, and afterwards they contacted us and said, 20% of our phone calls in the first 3 months of this year were about affording medications. Can you look to see if you can add these two medications to your formulary? Those medications cost $838 retail and $981 retail. And we were able to, uh, through our buying power, and was able to get that and add it to our formulary for $25 for 30 days and $45 for 30 days for those medications. So, NeedyMeds is so important for helping people to find, for helping to connect us and helping people to find that access to affordable meds. Just to show you a slide, because I didn't realize this wasn't in there, but we do have kind of the state of the art technology. So we are nonprofit, but we have technology that helps us to achieve a 99% dispensing accuracy. One of the things about RX Outreach I think it's important to mention here up front is that uh, we are not here to replace your local pharmacy, or local medication resources that you as maybe a provider may already have. We see ourselves as complementary to your existing relationships. We're one source, a reliable source, but we're one source for medication, and we take that very seriously. So some organizations, some clinics or doctors' offices may just have one patient they prescribe their medications here. And that's perfectly fine with us. We just want to be able to give access. Since we were founded in 2010, we've served 380,000 patients, $752 million. That's through 2019. And you could see here that we do have a long history of sustainability and providing medication to folks. just wanted to share here at the beginning some of our example of some of our medications. This actual list is included in the attachments today, but we carry medications for around 50, a little over 50 chronic disease states, um, and you can, because we are a mail order model, that makes sense. We sometimes we get requests for acute medications, which don't really work for our model. So we add those kind of sparingly. Um, so why RX outreach? Well, I think we are patient focused. This is our mission. Everything we do, whether it's the call center, whether it's the English, Spanish materials, the simplicity of our program is all focused on the patient and how to serve the patients most easily, and really to help our partners as well. Um, we're transparent. So RX Outreach doesn't have any hidden or additional fees. The price that you see on our website is the only price, and that includes the shipping costs. That includes free consultation. That's all. So, which is, as I've realized myself this past year, being at the pharmacy counter and having to guess, hold your breath, and when you find out that something isn't necessarily covered, what is it going to cost you out of pocket? You get that sticker shock, and then have to decide whether to stay there or to skip your medication. So what you see is what you get on our website. We have no enrollment, membership, or shipping fees. All that is included. Um, we serve uninsured, underinsured, insured household with incomes under 400% of the federal poverty level. Now you can see we have a little star there. And that is because of COVID. We've actually expanded that because we know that the need is great. I'll kind of explain, get into the details of that a little bit later, but just so you know, we do not take insurance. It's one of the ways that we keep our prices as low as we do. Um, RX Outreach is convenient. So it is mail order. It goes directly to someone's home. We folks in some states have to sign for the controlled substances, the controlled medications. But generally, we ship to people's homes. Sometimes clinics or doctors' offices receive the medications for their patients, but there's no coupons, discount codes, pharmacy cards, anything like that. We're also a sustainable source for affordable medication. So, there are, and I know particularly those in the clinic space, that there are other sources, particularly free sources of medication, but those do run out. So we um, carry the medications. We are able to buy them. We actually buy about 85% of our medications directly from the pharmaceutical companies. So we don't use short dated medications. We don't rely on donations, so that we would just have a very few things, very few bottles or pills, and then when we run out. So we know how important that the medication is for folks. We do have the free pharmacist consultation. So um, each department in our facility here does have pharmacists always on duty, and patients can ask them, so they get the same professional licensed uh, pharmacists, the consultations that they would at a regular pharmacy. And we are committed to serving um, and supporting NeedyMeds and all those constituents of NeedyMeds. We know they have a large footprint. So just a few examples again of our medication costs. This is an Excel sheet that is downloadable from our website on the Find Your Medication page. You can download everything with all the pricing. And we value that transparency. So when to consider RX outreach? Well, I broke this in just for a patient as well as for providers. So first, just patient. So for if any reason you're spending your own money, and that that if you are struggling with taking out of pocket for your medications, RX Outreach may be a good fit for you. If you don't qualify for assistance through a patient assistance program, Medicaid, if somebody is insured but their copays are too high, if somebody doesn't have documentation. So, some facilities, some programs require a lot of documentation, whether it's, passports and IDs, other paperwork that folks may not have for fear. We've had some folks with their taxes, and one program required that. And so, we like to keep it very simple. And I'll talk a little bit later about the eligibility, the how to enroll in RX Outreach. RX Outreach is important for folks that may have their compliance threatened by mobility or their lack of access. So, transportation barriers. I think this past, I think that it was either the last NeedyMeds presentation or the one before. There was somebody from a huge state out west, and they just found this to be RX Outreach should be very convenient because of that factor of mailing it, because particularly in the winter months, that it was just so arduous to travel. And for some folks too, with COVID, it's really a safety concern. They may have telemedicine, but if they still have to go to the pharmacy to pick it up, it isn't truly uh, totally telehealth. So we're glad to be able to assist there. And let's see, did I miss the medications? People have multiple medications and helps. And we know that people do break pills. There's a storm. They don't have money in the bank to be able to pay for it, and they'll stretch out that medication, and that adherence uh, is threatened. Um, so we help there, and then of course always simplicity. I just like to share this. This is uh, Clara, who is one of our wonderful patients, and um, when she found RX Outreach, she was so relieved because she had a number of medications, and individually, just the one prescription wasn't too much, but when she put all these prescriptions together, it was just too much for her. So she did a nice little interview with us last year, and I thought I'd share the picture. Carla usually likes when I share some patient stories, and I know that many of you here have those stories yourself. Uh, we have one I heard just a few months ago. I was talking to a patient, and she was so grateful to have found us because if she had not been able to save, I think $600 a month on her medications through RX Outreach, she and her husband were gonna. She could not stay in the home in order to take care of her husband, because if she didn't get these medications, she knew she was going to have to go to a nursing home, and then she said her husband would probably have to do it. They'd have to leave their home. So, we recognize that behind the tens of thousands of prescriptions that we send out each year, that there's real people and real stories. As a provider, some of the important reasons, again, as I mentioned, the free medication runs out oftentimes. We are partners we see with AmeriCares and Dispensary of Hopes, and we know that that free medication is crucial. When that runs out, we're here. When patients, again, do not qualify for other programs, documentation issues, when the existing relationships don't have the medication or particularly the strength that your patients need, we want to be there. Again, the transportation issues, and now certainly with the limitations due to COVID, that we can help folks to stay safe, particularly with existing telehealth programs that a lot of our clinics and doctors' offices have transitioned to during this past year. So our income guidelines, and again, this is the 400% that I spoke of earlier. These are our general guidelines. However, this year we did expand to include others who may be over that amount. We changed from 300 to 400% last year to match the federal subsidy for ACA and to match a lot of the patient assistance programs. But we knew that this year that people, it was unprecedented, that we needed to help more. So here are some of just the criteria that we have for expanded guidelines. And the reason I just wanted to show this slide is that this last number is that if there's any other reason why someone who may make over that amount of money thinks they should qualify, please let us know. We had to make this metric here just to be sure that we followed our bylaws and the integrity of our 501c3 status. So we had to document why we were going over the 400, but we've been very generous. And again, we want to help people. We know that we, as a mail order pharmacy, are uniquely positioned to really help folks with particularly the spread and of COVID and safety. And so if you have any questions about this or questions about enrollment, just to hit the lowest button there, activate your membership, and we will try our best to kind of work with you. Additionally, we did add Telehealth Partnership this year for folks, and this is really just to give our patients and others access to an affordable telehealth plan, $12.75 a month. And there's a few other plans there, but I just wanted to point that out. We actually don't get prescriptions as much from this partnership because a lot of telehealth replaces really urgent cares. And so that's more acute medications, but we just wanted to be able to offer this to people in need. So now the kind of the more nuts and bolts is how to use RX Outreach. Well, for our program, patients must be enrolled. And that means that they have to be enrolled and approved to qualify for our program. It is an easy process because you can enroll just with name, address, and the household income. We do audit. We kind of randomly audit our patients annually just to make sure that we are following in our mission. But it is a very easy process. The enrolling can be done online by calling our call center or through a mail-in application. And those applications we can send out to someone, or else they can download them from our website. We want to make it easy. So the only exception to the patients being enrolled is with the clinics. So if there is a clinic that already is already a partner clinic with us, which I'll talk about in just a second, then any prescription that you send for one of your patients, they're automatically enrolled, because our understanding is that if you're a free and charitable clinic, that you've already kind of screened your patient, they would qualify for our program. So after enrollment, one can submit their prescriptions by e-scribing, by fax, or by mail. We can transfer prescriptions by just going to the website, filling out a form. If somebody is new, we can call that. We will then call them and enroll them over the phone, or to help them to make sure that we could, if they already have an existing prescription, that we can call and get it from their doctor or from a pharmacy. And then as soon as there's payment, we ship out the medications. I think it's 98% of our prescriptions are sent out within, I think, 4 days. And sometimes when there is a payment issue or an address issue, or it isn't a completely clean script, it does take a little longer. But we do process those very quickly, and we do have refill and the renewal reminders by text, emails, and phone calls. So just to talk now about some of our specialized programs. So our preferred clinic program is is here to help with the free and charitable clinics across the country. We do also have some departments of health, um, some doctors' offices now. We actually are just starting that now, that doctors' offices can enroll and in our clinic program. And what that allows um, a clinic to do, or a doctor's office, um, it's all it's to manage your patients. And so you can see here we have two preferred clinic programs. One is the tier one, and that very simply is that the clinic is invoice for the order. So any order that is sent in, that we fill it, and then we just invoice you at the end of the month. And the tier two is a clinic that does not pay for their patient's medication. So they send in the prescription, and then we can contact the medication with the patient, and we'll kind of handle the payment. Um, this next slide will kind of give some of the more details of it, but um, you could see that we want to adjust to serve you best. So some uh, clinics like to do a lot of their refills and such through our patient portal, through the clinic portal. They can make they can get their savings reports, for which is important for grant writing. You can find out how much money you saved your patients, etc., and all that kind of tracking for our patients as well. Patients can view and manage their orders through the patient portal. One of the very nice things about this is we do offer, and this is kind of the only discount portion, this and one other program, that we offer 5% off our medications um, to all our clinic partners and those enrolled in one other program. And again, it's our way of helping your patients, and trying just to be that source of a dependable source for folks. We can expedite orders, and there is a dedicated team of supporters, of team members here that help the clinic. So you clinics and our partners go around kind of the call center and go and have a person that they'll work with. We also can offer them the discounts on the bulk medications, or excuse me, the bulk diabetic supplies and over-the-counter supplies, over-the-counter medications and such. We can offer those in bulk at a discount. Uh, Kind of getting to the end here, our Serving Those Who Serve Others program. This is a newer program. It's a pharmacy benefits program for our clinics, companies, um, and it's nonprofit agencies, but now we've also expanded that to for-profit agencies. So this is a program that gives those employees, full-time, part-time, access to RX Outreach. The employees and their dependents. And some clinics now have also included their volunteers. So the impetus for this program was actually internal. So RX Out, some of the employees here were having struggles with paying for their own medications, and so our company started to offer us as a benefit uh, our medications free of charge. And then we realized that there was a lot of other people, and so our, family members, they would also have access to the medications, not free of charge, but access, um, and with a slight discount, the 5% discount. And so once we realized that a lot of folks in a lot of places around the country could use this, then we did open that up. So we have a program, Serving Those Who Serve Others, that employees of clinics, of doctors' offices, those that some places have uh, a lot of part-time workers that do not have benefits. This helps keep the employees healthy. Um, and again, it's our way of kind of saying thanks for our partnership. This program is new. We just kind of launched it in the past year, And it's been a real blessing for companies that are trying to kind of keep their medication costs down and are keeping employees healthier and such. So Bridget's contact information is here. If you have any questions or would like to learn more about the program, or just put it in the chat or in the survey afterwards, and we'll be happy to reach out to you. One other program I wanted to share with you is just our Healthy Reentry program, because it is so unique. Our Healthy Reentry program uh, is a program for bridge medication for people getting out of jails and prisons. It was started in 2016 here in Missouri, and we piloted in St. Louis because we know that when people get out of a prison or jail, they generally don't have a permanent medical home. They generally don't have a job, insurance, money. Um, and a lot of folks have health needs, and there's just simply not enough time to get out of a facility and find a doctor, get an appointment, get a prescription, have the money to get it filled. Most states provide about 30 days of medication for someone as they leave, and it just wasn't enough time. So this program, Healthy Reentry, was launched, and it was entirely grant funded to start, with serving over 8,000 people here in Missouri, 40,000 free prescriptions. And it was really really a great program. And we did a lot of evaluation on it, and really sharpened it now. So now it is included in a lot of the contracts for prisons and jails, and also like mental health courts. So a lot of different facilities kind of use this program so that folks can get the medications that they need. We found that about half of the people in the program receive mental health meds, which we know that really helps um, people to stay healthy and to transition out of prison kind of into society as safely as possible. So that kind of concludes the presentation. I tried to go a little bit quicker today, um, because I wanted to allow for more questions. But RX Outreach is we try to be as supportive as we can to individuals and to our different partners, particularly in kind of the healthcare, the health safety net. Our website, as Carla mentioned, is pretty easy to navigate. And we love just to have the opportunity to assist you with getting affordable medication. If we don't have a medication that you're looking for, please let us know, and we'll check into it, and we'll get back to you pretty shortly, probably in the next 2 weeks or so. So Carla, I think that concludes my presentation, and I'd love to hear if there's any questions from our group today.
Absolutely. Bill, thank you much for taking time to share your expertise with the NeedyMeds audience. I think I said in the beginning that I really don't think when I introduce you that really your academic background and your professional experience really doesn't convey the passion that you have for helping people, and that extends to the entire RX outreach family. What I really want to stress is, as you can tell by Bill's presentation, they go out of their way to make the process, make it really easy to understand what RX outreach is and what they do. They have continued over the years to simplify and improve their process, making it much easier and much simpler for patients to get access to the medications they need. And as Bill said, be vocal about your experience with their website, and don't hesitate to reach out to their call center counselors if you do have any questions. We do have a bunch of questions coming in for Bill, which we're going to get to in just a second. I will remind everybody that if we don't get the chance to answer your question, we will follow up with you via email, and of course provide the contact information for NeedyMeds and RX Outreach at the end. Before we get to those questions, I do want to remind everybody listening in that NeedyMeds is also here as a source of support if you are having difficulty affording your healthcare expenses, which includes but is not limited to medications. What you're looking at on your screen are all of our cost savings resources that you can find under that healthcare savings tab that I pointed out in the beginning of the presentation. And again, if you'd rather just speak with a live person, sometimes that's easier. Don't hesitate to reach out to our call center counselors. I also, that looks a little funky. I'm sorry, everybody. My webinar looks a little bit off, but the information you need is up there anyway, which is there's a snapshot of some of our other upcoming webinars. And again, you can read more about these and other ones because we do populate our calendar of events through the end of, it's populated through the end of 2021. So check out other upcoming webinars or read about the ones on your screen and register for those. We do hope to see your name pop up in future webinars. So we do want to go ahead and take time to get to some of those questions coming in for Bill, and there are a bunch of them. As we get to those, I want to leave up the contact information, importantly for RX Outreach as promised. And you could find the NeedyMeds website at needymeds.org. Our call center phone number is on the bottom right of that screen. And if you have any questions about this webinar, don't hesitate to reach out to me at Carla at needymeds.org. So one of the questions coming in that you did cover, but I'm glad somebody asked this because it's an opportunity to drive it home, and I bet you get this question all the time, Bill, which is, can I use RX Outreach if I already have insurance?
Yes, absolutely. It is a common question, and people worry, I think, that if they use RX Outreach, it's going to affect Medicaid, it'll affect insurance, anything like that. It really is completely separate, and they honestly don't know, I guess. So yes, anyone who is qualifies is welcome to use us for some of their meds, for whatever we carry, and that doesn't affect their insurance or anything at all.
Thanks so much, Bill, for the answer, and thanks to our audience for participating in the questions portion of the webinar. I say this all the time, which is that if one person's thinking it, probably others are as well. Another question we that you probably get a lot, which is simply, how much does RX Outreach cost? And because I know the answer to this so intimately, I think it's the bigger question is, and then we get this a lot, is RX Outreach really too good to be true? But I'm going to go ahead and let you answer that question, which is, how much does RX Outreach cost?
Sure. So that we do have no membership fees or anything like that. It's just the cost of the medication that you see on our website. We actually get that a lot. We've had a lot of kind of coverage, national media coverage, this year, and we found that a number of the TV stations were kind of getting into the investigative reporters, that they're the ones who are looking into us, and they can see that we're fully licensed. We're a good charity. We kind of say what we do, and we're transparent and such. So that's why we've been in existence for 10 years. We're not a kind of a fly by night place. All our medications are from our source from safe from safe places, and we're involved with some groups that make sure that we have that kind of integrity. So yes, we do exist, and it seems too good to be true, but it really is. This organization, and I kind of tried to hit on it at the beginning, it really is so unique. When I started in this at RX Outreach 4.5 years ago, I started with in the development fundraising department, right? And there was just two of us, but anyone here who works in nonprofits knows that that's kind of an important part to keep the lights on and keep things going. And I remember saying, why don't we just add $1 to each prescription, and then we wouldn't have to do this fundraising? And I was kind of put in my place when said you need to start listening to some of the patient phone calls, hear who our patients are, go to the clinics, see what people are struggling with. And it's when I really came to understand why we work so hard to keep our prices as low as we can, to keep it simple. I did an interview on our patient or our provider blog this past couple about 2 weeks with an organization out of Virgin Islands, Patient Assist Virgin Islands, and their whole they just help people to find affordable medication because it is so difficult. And they found us after they had the two Category 5 hurricanes within 2 weeks, and they just said that it was just so helpful to have something that they knew was reliable, consistent, and it was just easy to navigate. So, yeah, we're really proud of that history and the opportunity to kind of be transparent and to serve.
Thanks so much, Bill, and thanks to our audience for asking that question, which I said I'm sure you get all the time. I know I get it when I refer people to RX Outreach, and it was a great opportunity to share a little bit of the history about RX Outreach with our users. We are getting questions, and again, I bet this is something you get a lot. We're getting questions about Medicare patients, which is, can Medicare patients turn to RX Outreach? And specifically, what if they have Medicare Part D? I wonder if that's a question that you can answer, or if that's something we would refer our users to one of your call center counselors for.
Yes, that's correct. So because we don't take insurance, or we don't take, it's really kind of cash only. I say cash, but it's credit card, FSA, debit card, checks. Um, so we money orders. So we get all those, but we don't process it, run it through insurance or anything like that. So people are welcome to use us and to get their medication from us, but they would have to pay um, out of pocket. They'd have to pay for their medication. Then they couldn't apply it to that. So they can use it. A lot of people do, particularly at the end of the year, when people, the donut hole is I think as large as it used to be. But once people kind of find out and they say, well, look, if it's only a $3 difference from what my copay was, but you know what, I can have it delivered to my home, and instead of just 30 days, I can get 60 days, 90 days, 180 days. You get 6 months of medication, and it's $20. If they can afford that, they say, this makes it worth it for this medication. And we can help if you want to, see our website, look at the prices, see if we have your medication, and then give us a call, and we can kind of help you with that. And sometimes we ask if a doctor's office will has a couple refills on it, a medication, we can consolidate those, and so that you have your 90 days instead of just a 30-day, 30-day, 30-day that's mailed out. But it kind of depends on the medication. The different states have different laws too. So New York has different laws, but because we're licensed in all 50 states and we're up on all the laws, that we can help you with that.
Thank you so much, and I'm glad you had an opportunity to answer that question, but also that were able to drive home the fact that don't hesitate to reach out to the call center counselors at that 888 number in case you have any questions that feel confusing to you. Don't hesitate; that's what they're there for. Another question coming in is, and again, I bet this is one you get a lot, which is, where do you get your medications? Are they safe?
Sure, and that is a great question, especially now with a lot of with some states talking about importing medications from Canada that may circumvent kind of the DEA and some of our kind of existing kind of our existing system here in the United States. All our medications are approved. We buy them, as I said, directly from the manufacturer. We have, everything is kind of traced too, so we know exactly where everything's coming from, and it's all part of our. It used to be VIPS, Verified Internet Pharmacy. Now it's National Association, NABP, National Association of Boards of Pharmacy, and there's a whole lot of a whole lot that we have to do to continue to be accredited by them. But all of it is safe, and we have everything tracked. If there is something like a recall, we reach out to our patients right away. That does happen occasionally. But it is all safe, and it is all. That's the importance of a whole department that just keeps track of that.
Thank you, Bill. And you mentioned earlier, I think when you were talking about eligibility, um, you referred to non-U.S. residents, and we got a question from one of our audience members saying, "Does it mean that non-U.S. residents are eligible?"
So we are able to we can mail our medications to a valid address in the United States. Um, and so even though earlier this year with COVID, a number of people reached out to us. There's actually a lot of the doctors whose parents lived overseas or weren't residents here, but were living here due to quarantine and travel restrictions. And we are able to fill those, most of those, some because of different regulations, particularly with controlled different classes of the medications. um, some of them we do need like a valid government license, and such. But for the most part, if somebody is here living in the United States, we have a valid address. We can provide medication to them. It's one of the questions I think to call and to ask us. Um, we also do provide, and I should have mentioned this earlier, but we also provide tear off pads. There's a lot of like materials that in Spanish, English, that if a clinic which serves folks of a particularly nationality, or a certain language group, let us know and we can kind of send materials. But we want to do our best just to serve people, and we will do everything we can legally to provide them with that medication. So please reach out to us about kind of particular medications and particular locations.
Such an important question and an important topic. And I also will take the time to mention that NeedyMeds, all of the programs that we connect our users to free and anonymously under that healthcare savings tab, all of the different programs do have their own eligibility requirements. And often the eligibility requirements have to do with income, insurance coverage, but also residency. Although some of the programs do require that somebody be a legal, documented resident, many of them simply require that the person resides or is being treated in the United States. I'm stressing that because if you are or work with a population or have loved ones that fall into the undocumented category, don't hesitate to reach out to NeedyMeds because we can help. And we also do have a safety net of a drug discount card that if we can't connect you to a cost savings program, if RX Outreach doesn't have the medication right now that you need, we do have a drug discount card that will hopefully help you to save up to 80% off the cash price of prescription drugs. So don't hesitate to reach out to either NeedyMeds or RX Outreach, as Bill said, for any additional questions. Bill also said, he said, I didn't get the chance to mention this, and he talked about some of the printed materials, some of the materials you can print out from RX Outreach. That's a great opportunity for me to remind you that Bill said in the beginning, which is true, that he's providing a high-level overview, sort of the broad strokes for RX Outreach. So I recommend checking out their website, familiarizing yourself with the breadth and scope of the resources they have to offer, because a lot of that is educational information that you can use or you can share with your patients, clients, or loved ones. And again, don't forget to check that handout section in your GoToWebinar control panel, because in addition to our 2 PowerPoint presentations, you will also find 3 really helpful PDFs from RX Outreach. So don't forget to check those out. So we're going to go ahead and wrap up today's presentation. If you did not get your question answered, again, you can reach out to RX Outreach or NeedyMeds as the contact information on your screen. But of course, we will follow up with you by email. What else did I want to say? Of course, I wanted to offer our deep thanks to my friend and colleague Bill for taking time out of his day to share his expertise and his enthusiasm with the NeedyMeds audience. And to our audience, it's a busy time of year. There's a lot going on. And as Bill said, it's been a challenging year. So we appreciate your taking time out of your day to learn more about NeedyMeds and, importantly, RX Outreach. So thank you for that. I hope everyone has a safe and healthy holiday season and that we see your names pop up in future webinars in 2021. Thanks, everybody. Have a wonderful rest of the day. And thanks again, Bill. Take care.
Thanks, Carla.